Our patients have definitely evolved and changed, and so has our field. People have a lot more interest in the services that we offer. A lot of them are considering, but some of them are kind of worried that they don't want to have plastic surgery.
Patients are now talking about it, and they're letting their family members know what they're doing, and encouraging them to have the same procedures done, which is very different than when I started practice. When I started practice, they would have a procedure. A patient may come back a few years later to do something else. But now, as soon as that patient has a procedure, their spouse will have the same procedure. Their first cousin, their brother or sister, the same exact procedure, because they're so happy with the results. They want to tell everybody, and they want everybody else to have the same experience.
There is something for everyone, depending on what their fundamental goals are. And sometimes the goal, which people may not be aware of, is to stay the same. Very often in our practice, patients will take baby steps or dip their toe in. Start with something like skincare, or maybe one area of Botox. And what happens to that patient?
Then they realize, oh, I did not realize, Dr. Bharti, you do lip filler. So maybe they start getting lip filler. I've always thought about a breast augmentation. Can you talk to me about a breast augmentation? And there's this evolution, because these patients are patients for life. Once they're part of the practice and they get to know each provider, they feel comfortable. You become one of the family members. And we like to joke around a lot of times. In fact, I think we're the new primary care doctors, because we see our patients all the time and we really, really know them extremely well.
I had a patient of mine, this is so good, and she had to get some other procedure done by a GI provider, and they said, "Who's your primary care doc?" and listed me, the plastic surgeon. So I think there is some real truth to that. Part of it is developing trust, engaging in conversation, and building rapport so that we know what's going on in this patient's life, what their goals are, and sometimes we have to lay that out there.
Isn't it interesting when they come to see us that we kind of create this treatment plan for life, and it's not just a one-time treatment plan, it's more of a continuum of what we're able to offer these patients. And I think that's why there's trust, and that's why they keep coming back to see us.